At a hospital in Banyuwangi Regency came a patient who had a history of cervical cancer. The patient's name was Mrs. Camilla. The patient came from the hospital's emergency department. The patient came with complaints of non-stop bleeding for about 1 year. After completing all administrative matters, the nurse immediately gives action to the patient.
Good morning, madam.
Good morning, nurse.
Let me introduce myself. My name is Nurse Oki. I am a nurse in charge of conducting an assessment of your condition, which will be used to existing problems and nursing needs that you need. I will ask some questions starting from your identity, medical history, and physical assessment. When I ask Madam could answer according to your actual conditions. Are you willing to be given this action, Madam?
Yes, nurse. I am willing to be given an assessment action.
Okay. Are there any questions before I take action?
For this time, I have nothing to ask, nurse.
Okay, thank you, Madam. First, I can start by asking your identity. Can you tell me your full name?
My name is Camilla Aulia.
I'm sorry, Madam. Is it true if your name is Camilla Aulia? K A M I L A U L I N A?
Yes, nurse, that's true.
Okay, madam. Then, can you state your date of birth?
23 May 1995.
Okay, next. How old are you?
I'm 26 years old.
Okay, for your gender is female. Next, can you mention the religion that you follow?
I'm Muslim, nurse.
Okay, next. Can you mention your educational history?
I have graduated from high school.
Okay. Do you have a job?
I work as a manager marketing.
Okay. Are you married?
I haven't married yet, nurse.
Okay. I will write down the medical record number, MRS number, and review data to complete your assessment data. Okay, madam. Next, I will ask you some question about your medical history. Maybe first, have you ever had a medical diagnosis or disease that was conveyed by a doctor?
Yes, nurse, I was diagnosed with cervical cancer.
Okay. For now, what complaints do you feel?
I feel pain when I'm moving, like being pulled for 1 to 2 minutes. If I walk, my feet still hurt and seem to float. I have non-stop bleeding for about 1 year. In fact, I change my pads 10 times a day.
Okay, madam. Maybe there are other complaints that you feel right now.
I feel colic in my right lower abdomen.
Okay. Does madam have a history of illness in the past? Maybe it is related to madam's medical diagnosis. How is the menstrual history of you, madam?
I had my first period when I was 13 years old. I have had continuous bleeding for about 2 years. The menstrual cycle before the bleeding occurs regularly, usually 5 or 7 days, in large quantities, fresh red, and I change my pad 3 or 5 times a day. During my period, I usually had severe pain like twisting.
Okay, madam, thank you. Furthermore, does pet have a history of other disease before?
Yes, nurse, I have blood low pressure. My head is also very dizzy and painful every time I get my period.
Okay. Does your family have a history of previous illness?
Yes, nurse, my mom passed away during the childbirth to cervical cancer.
Okay, the last. Do you have any allergies to anything? Maybe food, medicine, or maybe something else?
Yes, nurse, I have allergies. I'm allergic with seafood. If I eat seafood, I feel very itchy.
Okay, madam. The identity and your medical history has been filled in complete. Next, I will do a physical assessment to complete your physical assessment data.
Thank you, nurse.
Yes, madam.
Yes, I will do physical observation. First, I will check your blood pressure and your heart rate for about 2 minutes. Okay, miss, do you have any question? Okay, I will start checking right now. Excuse me. Okay, miss. After I did a blood pressure check, I got your blood pressure result, which are 130 per 90 millimeter of mercury, respiratory rate 18 time per minute, heart rate is 84 time per minute. Okay, miss. Next, I will take your temperature. Okay, any question? Okay. Excuse me. Excuse me. Oh, well, after I measure your body temperature, I get the result of 26.5 degrees Celsius. Okay, miss. Next, I will check your weight and height. Come here, let me check. Okay, miss. After I did the examination, I got the result that your weight is 40 kg and your height is 155 centimeters. So, I get your body mass index of 20.81. Next, I will ask some questions about your physical condition to complete the data. Some of these questions are about diet pattern, elimination, chapter, urination, clinical things, and several things related to your activity and spirituality. When I ask a question, please answer according to your condition. Okay, miss, any question? Okay.
After a nursing assessment, the patient was diagnosed with acute pain problems and the risk of bleeding. the patient was transferred to the inpatient room for nursing care.
Okay, good morning, Mrs. Camilla. Is it true it's the name of Mrs. Camilla, right? Can I check your identification bracelet? Okay, can you tell me your date of birth? Well, is it true you can say yes? Let me introduce myself. My name is Nurse Adisa, whose the morning was tasked with providing nursing care to you. After a nursing assessment today, one of the diagnoses that was enforced is acute maternal pain. So, on this day, I will help you to monitor the acute pain that develops comprehensively. Maybe it's about 5 minutes. For the procedure later, I'll teach you to the progressive relaxation techniques. Then I'll ask some questions related to acute pain complaints. Later, you can be able to answer carefully according to the condition. Was there any question before I took your action? Okay, Mrs. Maybe I can start the action. The first, you can lie down or sit on the chair. Thank you, Mrs. Next, I will explain that there are 4 main muscle groups of the body that will be used in relaxation techniques. The first, hands, forearms, and muscles. Number 2 is head, face, throat, and shoulders, including concentration of attention to the forehead, cheeks, nose, eyes, jaw, lips, tongue, and neck. 3. Chest, stomach, and lower back. And 4. Thigh, bottom, calf, and legs. And the last is hand, forearms, and biceps muscles. Okay, the first, you can clench both hands like this and tighten the biceps and forearms for 5 until 7 seconds, like this. How does the feeling, Mrs. Camilla? Is it hard? And then, feel the tense muscle area, muscle tension, and then relaxation of about 12 until 30 seconds. The next, contract the forehead to the top, and I will press the head as far as possible to the rear. Then I will also turn your head. Then try to contract the facial muscles like a frown, blinking eyes, first lips, tongue press up, and shoulders bend for 5 until 7 seconds. And then feel tense the muscle and relax. Next, arch the back of your back while inhaling. Then I will press out the stomach. Hold, then relax. Take a deep breath and hold it, then relax too. And last, pull the foot and toes back toward the front. Like this, Mrs. Hold, relax. Then fold the thumbs and tighten the calves as well as the thighs and bottoms. Feel it again. Then tense the muscles. After that, relax. Okay, Mrs. Camilla, for the action of relaxation techniques have been implemented. Thank you and follow the instructions I give, and you have also sat more comfortable. The action is done. Mention to return to the nurse station. If there is something to be conveyed, you can ask the family to help to call us in the nurse station or press the bell that is already available. Is there anything to ask Mrs. Camilla? You're welcome, Mrs. Camilla. I was allowed to go back to the nurse station. Wassalamualaikum warahmatullahi wabarakatuh.
A few hours later, the patient was again given nursing care for a diagnosis of bleeding wrist.
Good morning, mother. Is it true that this is in the name of Camilla's mother? May I check your identification document? Okay. Can you state your date of birth? Yes, it is true. Camilla's mother. I introduce, I am Susan, who is in charge of providing nursing care to mother this afternoon. Good mom. After nursing assessment yesterday, one of the diagnosis made for the madam in the risk of maternal bleeding. So I today help mother to do vital seeing observation. It might take about 15 minutes. Consider later, I will check mother blood pressure, temperature, respiration rate, and heart rate. Any question before I do the mom action? Well, mom, maybe I can start the action. First, I will measure the mother blood pressure. This is mother. Good mother, for the action has been done. I got the result of the mother blood pressure, which is 110 or 90 mmHg. Next, I will measure of the mother body temperature. Okay, kesini, you can open mouth. Okay. Good ma'am. For today action is done. Thank God I was able to follow the instruction I give. I got the result of mother body temperature is 360 Celsius. Respiration rate is 18 times per minute. Heart rate 80 times per minute. The action has been complete, madam. I have permission to return to the nurse's room. If there is something you want to say, you can ask the family in the call nurse's room, or in the above already available. Do you have any question, madam? Some assumption I was allowed to return to nurse's room. Wassalamualaikum.
After nursing actions, the diagnosis of acute pain and the risk of bleeding from the patient was partially resolved.